Well, she called me brilliant, but I could argue that. So, like Ann said, my name is Katherine Ligon. I'm with the Center for Public Policy Priorities. And if I could take a brief moment of personal privilege and just thank everybody for coming. This has been kind of a year's worth of work that we've been on this journey of trying to figure out how peers can be a part of the reentry process into and communities to maintain a continuity of care and stop recidivism. And so I thank Ann and my direct supervisor, Ann Duckelberg, who really fostered and creativity and freedom to be able to kind of start the research and move forward. And also like to thank Sheriff Garcia and Leon Evans and the folks from Peerstar LLC and Dr. Nulton for being here, who are just willing to be a part of this conversation. We can all figure it out together and move forward. So I'm going to skip through a couple of slides because, oh, that's good to know. Because I would have hit a blank button. No. Thank you so much. So I'm going to skip through a couple of slides because Ann went over the history of the Center for Public Policy Priorities and get to just kind of the core of why we're here is really talking about recovery and the opportunities of recovery. And this is a definition from SAMHSA that I think it's a good definition that we can all kind of seek. And so I think at the core of it, recovery emerges from hope, and that hope is internalized and can be fostered by peers, families, providers, and other people within our communities, and is the catalyst for the recovery process. And I think it's really possible. We just need to create several pathways in which individuals with living experience of mental illness can just get onto that path. So next, because the policy wonk nerd in me kind of has to go here, is to talk about the funding levels for mental health in the state of Texas. And so what you have here is on the bottom, the darker orange is the per capita funding since 2001 for Texas. The expenditures for Texas, which starts at $37 in 2001. In an 11-year period of time, the median goes from $68 to $104. Meanwhile, Texas has stayed essentially the same, only increasing to $38. That's 11-year period of time. That's why you've probably heard in the media that Texas is ranked bottom or 50th or 49th, 48th at per capita expenditures for mental health in the state of Texas. And so to move forward, you can kind of see the kind of the history as far as what the allocation has been. Although it has increased over the bienniums, it hasn't really accounted for the community need and the population growth. We are a growing state here. We have a very fast growing population in Texas, and so the funding hasn't kept up with that level. But in the last session, which was the biennium for 2014 and 15, the Texas legislature really took some smart actions by allocating funding to support various components of mental health programs in Texas, community-based services, crisis services, and really create an opportunity for us to create a foundation where we can move forward and help support individuals moving to a path of recovery. And so, in the orange is what what's been is the legislative appropriations request for this upcoming biennium as we move forward into the next legislative session, which starts in July. I wish. January. Don't we all wish it was July, right? So this is just a way in which we can kind of visually see where our level of funding has moved towards. We're there. I think we're on a right path. We've got to maintain at least the level of funding from this this current biennium into the next biennium. I think we can see real opportunities for change. So to move past that little bit of world wonkiness well, you've also heard probably in our various conversations in the news that the jails and the emergency rooms are the de facto mental health providers in the state of Texas. Local sheriffs and hospital administrators have been very vocal about the high number of individuals with living experience of mental illness are rotating in and out of these of jails and emergency rooms. Incarcerating rather than treating an individual, it comes at a very high physical cost and also a human cost. And Tuesday spoke very, very clearly about that human cost of what it is to be caught in this revolving door and just can't get out. She did get out.
I want to go back in.
Exactly.
For the help.
So this is just a graph that shows the cost of incarcerating versus treatment. So on the top, in a state correctional facility, the psychiatric unit, it costs on average of $138 a day to serve somebody. And that's just the bare minimum. That's just kind of what the average is. It could depend on the needs of the individual, but it could go higher than that. And then it costs an average of $59 a day to serve somebody in the local jail, just an average here in Texas. And then if you're serving somebody with a serious mental illness, I'm sure Sheriff Garcia can get more specific about the actual cost of of serving somebody in a county jail with serious mental illness, whether it's medication, whether they need to be in a specialized unit. The costs associated with that get more and more. But to serve somebody in the community, it costs an average of $12 a day. And I think that's really important to demonstrate because there's a great opportunity to serve individuals in the community in the least restrictive setting, and that they have the power to be a part of their treatment process, and that they're living in the community that they want, and it comes at a very low cost for the state. So talking about this kind of revolving door here, I want to make sure that we kind of talk about some of the challenges of the individuals that really Tuesday was kind of just talking about her personal experience of when you're rotating out of the jail system, that there are significant challenges for an individual with lived experience of mental illness to stay out of jail, essentially. The suicide rate seriously increases. There's a decline in your mental health treatment. When you're coming out of jail, my best guess is that your mental health treatment is not your first priority, but where you're going to live, where maybe if I had a job, do I lose my job? Do I have a relationship with my family anymore? Is my family just kind of fed up? Those are the things that I think become more of a priority than getting to your community mental health center when you're coming out of jail, and that becomes further and further more of not a reality of getting connected with the community mental health center right after jail. Homelessness, the use of emergency rooms, all are at a higher rate, and also the financial costs associated with that, whether it's from on a public system or for the individual as well. And of course, recidivism, more likely to recidivate as individuals are not connecting with the community, just getting back into that revolving door. So this fancy chart is the sequential intercept model. And this was a booger to put together. I mean, just so that we could get through. I think it's important to highlight that we've talked a lot. There's a lot of opportunity to talk about diversion versus reentry. We will always have a place in which we need to have diversion is absolutely critical. But we also need to talk about reentry because it is likely that there are some offenses that some individuals are going to have to be incarcerated for whatever the offense is, and that we need to successfully help them transition out of the jail system. And so talking about recovery, I'm going to skip this slide because I think we've talked about peer support and the opportunities of peer support, and get to really talking about what what this project really has been is that we have been working. We were working, had this idea of working with, of creating, or better understanding the use of peers and how they can be a piece of the reentry process. So Megan and I, who is no longer with the center, but she was an intern with our health team. I stole her from my boss, in fact, for the most part. And so she and I worked together on doing this research. She called various states and was looking at what are other states doing. What we ran into was that there are a lot of states that are not actually doing or not able to tell us what they're doing just because they don't know, or there might be some individual projects throughout various states, but that we ran into Pennsylvania, and Pennsylvania has some of these great opportunities. And so we're very fortunate actually that Peerstar is here today, who shared with us their model and shared with us some of the ups and downs of creating a program like this. And so I'm very, very grateful that they are here today. And so we ran into, they were very generous with talking with us and sharing their concepts and what they're proposing, or what they actually are implementing on a daily basis in 23 counties throughout Pennsylvania. 23, right? And so they have a peer that's trained, go into the jail system 30, 90 days prior to an inmate's release. They provide that inmate with pre-release services like planning, case management, mentorship, in an effort to help that individual transition out of the community successfully, connect them with the community mental health center, and then and make sure that they, if there's a wait period or if there's just things that need to get settled as you're transitioning into the community, they're there to provide that support and that guidance and the experience of like, I know what it's like to have a lived experience of mental illness. They might not necessarily have a lived experience of incarceration, but they have a lived experience of mental illness, and they're able to share that experience. And so Peerstar, I'm not going to take too much of what they are going to present to you today, but they were shared with us some great outcomes that really demonstrated the true opportunity of creating a program like this in Texas. Is that after a 3-year point in time of their incarceration rate for individuals who had gone through the program their recidivism rate was 24%. I want to make sure I said that correctly. And that was in comparison to other individuals who had been in the prison system in that same state. And so they're going to be here talking to you about what it is operationally to work in having a peer support program. And one piece of information that I skipped ahead when I skipped a slide is that when we have 40% of all bookings in the state of Texas in a county jail are for individuals who have already received public mental health services. 40%. That's quite significant. I think there's an opportunity here, and I look forward to hearing more from Dr. Nulton and Elissa to learn more about their Peerstar program and what it could look like here in Texas. So thank you so much. We're going to have a quick break, and then we'll come back in 10 minutes and hear from them. Thank you so much.